A 92-year-old doctor in Japan still walks without pain, climbs stairs without holding the railing, and says most knee problems after 50 don't start in the knees at all. They start with what you do, or don't do, in the first 5 minutes after waking up. Today, we're going to talk about something many people quietly struggle with but rarely discuss in detail, and that is knee pain that seems to come out of nowhere as the years go by. If you've ever felt stiffness when getting out of bed, a sharp discomfort when standing up from a chair, or a dull ache that lingers through the day, you're not alone, and more importantly, you're not without options. I'd like you to stay with me for this, because what we're about to explore is simple, practical, and something you can begin tomorrow morning without special equipment or complicated routines. And before we go further, take a moment to share your experience in the comments. Have you been dealing with knee pain, and when did it start for you? Also, tell us what city you're watching from. It's always comforting to see how many people are walking this path together. This matters especially for older adults, because knee pain doesn't just affect movement, it slowly takes away independence, confidence, and even the desire to stay active. But small, consistent actions can change that story more than most people realize. 1. The real reason knee pain gets worse after 50. As we move past the age of 50, many people begin to notice that their knees feel different, not necessarily injured, but less reliable, more sensitive, and slower to recover after simple activities like walking or standing for long periods. What often goes unnoticed is that this change rarely begins in the knee joint itself. Instead, it starts with the gradual weakening of the muscles that are meant to support and protect the knee, especially the quadriceps at the front of the thigh and the hamstrings at the back. Over time, if these muscles are not regularly engaged, they lose strength and stability. When that happens, the knee joint is forced to take on more pressure than it was designed to handle on its own. Imagine a chair with loose legs, where the structure is still there, but the support is no longer strong. Every step, every time you sit down or stand up, places extra strain directly on the joint surfaces. This added stress can lead to inflammation, stiffness, and the gradual wearing down of cartilage. Many people are told this is simply aging, but that explanation can be misleading. Aging plays a role, yes, but inactivity and muscle loss play an even bigger part. Without proper muscle support, even a healthy knee can begin to feel painful and unstable. The important thing to understand is that this process is not always permanent. When the surrounding muscles are gently strengthened again, they begin to absorb more of the load, reducing pressure on the joint. This is why addressing muscle weakness early, even with simple daily movements, can make a meaningful difference in how your knees feel and function over time. 2. Why mornings are the most important time. Morning is a unique window for the body, especially for the joints. After several hours of sleep, the body has been still, circulation has slowed slightly, and the fluid inside the joints, which helps them move smoothly, has settled. This is why many people notice stiffness or a heavy feeling in their knees when they first get out of bed. It is not necessarily a sign of damage, but rather a sign that the joints and surrounding muscles have not yet been gently woken up. What makes this time so important is that the body is highly responsive to gentle movement right after waking. A few minutes of slow, controlled motion can help stimulate blood flow, warm up the muscles, and encourage the joint to produce and circulate its natural lubricating fluid. This process helps reduce friction and prepares the knee for the movements of the day ahead. If this step is skipped, people often go straight from stiffness into activity, such as walking, climbing stairs, or carrying weight. This sudden demand on a cold, unprepared joint can increase discomfort and, over time, contribute to further irritation. It is similar to starting a car on a cold morning and immediately driving at high speed, rather than allowing the engine a moment to warm up. By taking just a few quiet minutes in the morning to activate the muscles around the knee, you create a smoother transition from rest to movement. Over time, this simple habit can reduce that familiar morning stiffness, improve confidence in each step, and set a calmer, more stable tone for the rest of the day. 3. The simple exercise recommended by the Japanese doctor. The exercise itself is almost surprisingly simple, and that is part of why many people underestimate its value at first. Sitting comfortably on a sturdy chair, with your back upright and both feet resting flat on the floor, you begin by slowly extending one leg forward until it becomes straight. The movement should feel controlled and steady, not forced or rushed. Once the leg is extended, you hold it gently in that position for a few seconds, allowing the muscles at the front of the thigh to engage and support the knee. Then, just as slowly, you lower the leg back down to its starting position. This movement is repeated several times on each side, with a focus on smooth breathing and careful attention to how the body feels. The goal is not to push through pain or to create strain, but to reintroduce stability and strength in a safe and gradual way. Many people find that even holding the leg up for a short moment can feel challenging at first, and that is completely normal. It simply reflects muscles that have not been regularly activated. What makes this exercise effective is that it directly strengthens the quadriceps, which play a key role in supporting the knee joint during everyday movements like standing, walking, and climbing stairs. At the same time, because it is done in a seated position, it reduces unnecessary pressure on the joint itself, making it accessible even for those who already experience discomfort. Over time, with consistent practice each morning, this small movement helps restore balance around the knee. The muscles begin to respond more quickly, the joint feels more supported, and simple activities become less intimidating. It may not look impressive from the outside, but inside the body, it is quietly rebuilding the foundation that the knees depend on every day. 4. Why slow movement works better than intense workouts. Many people believe that in order to improve strength or reduce pain, the body needs to be pushed hard, but when it comes to the knees, especially after the age of 50, this approach can often do more harm than good. The knee is a sensitive joint that depends heavily on balance, stability, and controlled support from the surrounding muscles. When exercises are done too quickly or with too much force, the joint may experience sudden pressure that it is not prepared to handle, leading to increased discomfort rather than relief. Slow movement, on the other hand, allows the body to stay in control at every stage of the exercise. When you lift your leg slowly, hold it, and lower it with care, the muscles are given time to engage fully and work together in a coordinated way. This kind of movement strengthens not only the larger muscles, but also the smaller stabilizing muscles that are often overlooked yet essential for protecting the knee. Another important benefit of slow exercise is improved awareness. You begin to notice how your knee feels during each part of the movement, whether there is tightness, weakness, or imbalance. This awareness helps prevent overexertion and reduces the risk of injury. Instead of reacting to pain after it happens, you learn to move in a way that avoids triggering it in the first place. From a physiological standpoint, slow and controlled motion also encourages better blood flow to the joint and surrounding tissues. This helps deliver nutrients, remove waste products, and support the natural healing process. Over time, this creates an environment where the knee can function more smoothly and with less irritation. In contrast, intense or fast-paced workouts may temporarily strengthen muscles, but if they are not done with proper control, they can place uneven stress on the joint. For many older adults, the goal is not to train harder, but to train smarter, choosing movements that build strength gently, protect the joint, and can be repeated consistently without fear. 5. The overlooked role of daily habits. While many people focus on exercises or treatments to relieve knee pain, the quiet influence of daily habits is often where the real story begins. The way we sit, stand, walk, and rest throughout the day places repeated patterns of stress on the knees, and over time, these small actions can either support joint health or slowly wear it down. What makes this challenging is that these habits feel normal, so they rarely draw attention until discomfort becomes persistent. For example, sitting for long periods without moving can cause the muscles around the knee to become stiff and less responsive. When you finally stand up, the joint suddenly has to bear weight without proper support, which can lead to that familiar feeling of tightness or instability. Crossing one leg over the other for extended periods may seem harmless, but it can create imbalance in the hips and thighs, which then affects how pressure is distributed through the knees when you walk or stand. Even something as simple as how you rise from a chair plays a role. Many people rely heavily on their knees alone, rather than engaging the muscles of the thighs and hips. Over time, this repeated pattern increases strain on the joint. Similarly, wearing unsupportive footwear or walking with short, uneven steps can gradually shift alignment and place uneven stress on one side of the knee. The important thing to understand is that these habits are not harmful because of a single moment, but because of repetition. The body adapts to what it does most often. If those patterns are unbalanced, the joints begin to reflect that imbalance. The encouraging part is that small adjustments can make a meaningful difference. Standing up with awareness, taking short movement breaks, sitting with both feet grounded, and walking with steady, even steps can all reduce unnecessary strain. When combined with simple morning exercises, these changes create a supportive environment for the knees throughout the entire day, not just during a few minutes of activity. In many cases, the turning point does not come from a dramatic change, but from a quiet decision to do something small every day. I remember a man in his early 70s who had gradually stopped taking his morning walks because of the discomfort in his knees. At first, he told himself it was just a temporary break, but weeks turned into months, and his world began to feel smaller. Simple tasks like going to the store or visiting a neighbor started to feel like burdens instead of routines. When he began practicing the gentle morning exercise, he was skeptical. The movement felt almost too simple to make a difference, and during the first week, he noticed very little change. But instead of stopping, he continued, treating it not as a quick fix but as part of his morning rhythm, like brushing his teeth or making coffee. After a couple of weeks, he described a subtle shift. The stiffness he usually felt when standing up was less intense, and he no longer needed to pause as long before taking his first steps. Encouraged by this, he kept going. Over time, the improvement became more noticeable. He began walking short distances again, first inside his home, then outside to the end of the street, and eventually around the block. From a scientific perspective, this gradual progress reflects how the body adapts. Gentle, repeated movement helps restore communication between the brain and muscles, improves joint lubrication, and strengthens the support system around the knee. It is not about forcing the body to change, but about giving it consistent signals to rebuild and adjust. What stands out in stories like this is not just the physical improvement, but the return of confidence. When movement feels safer, life begins to open up again in small but meaningful ways. What many people do not realize is that the most serious knee problems rarely begin with a sudden injury. Instead, they develop quietly over the years, built on small moments of stiffness that were ignored, movements that became limited, and muscles that slowly stopped doing their job. By the time the pain becomes strong enough to interfere with daily life, the joint has often been carrying extra stress for a long time without support. The Japanese doctor behind this simple morning exercise often points out something that can be difficult to hear but important to understand. In his decades of experience, many patients who eventually required invasive treatments, including surgery, had early warning signs that could have been addressed with gentle, consistent care. Not extreme workouts, not complicated therapies, but small daily actions that were easy to overlook or postpone. The surprising part is not that the knees can worsen over time, but that they can also improve when given the right kind of attention. The body has a remarkable ability to adapt, even later in life, but it responds to consistency more than intensity. Ignoring the problem allows the cycle of weakness and strain to continue, while simple daily movement begins to reverse that cycle step by step. There is also a deeper consequence that goes beyond physical pain. When knee discomfort increases, people tend to move less, and when movement decreases, overall health begins to decline. Balance becomes less stable, muscles weaken further, and the risk of falls quietly rises. What started as a small discomfort in the knee can gradually affect independence and quality of life. But this is where the perspective shifts. The same cycle that leads to decline can be redirected. A few minutes each morning, done with care and consistency, can begin to restore strength, improve stability, and protect the joint from further strain. It may seem almost too simple, but sometimes the most powerful changes begin in the quietest ways. So if you take anything from today, let it be this. Your knees are not just joints, they are supported by a system that responds to care and attention, even later in life. Pain does not always mean damage beyond repair, and stiffness does not mean the end of mobility. By giving just a few minutes each morning to wake up your muscles and support your joints, you are investing in your ability to move freely, to stay independent, and to continue living life on your own terms. Start gently, stay consistent, and listen to your body with patience rather than fear. If this message resonated with you, take a moment to like this video and share it with someone who might need it, especially a parent, a friend, or anyone who has been quietly dealing with knee pain. Subscribe to the channel for more simple, practical health guidance that respects your pace and your experience. And remember, it's never too late to begin taking care of your body in small, meaningful ways. Sometimes, the path back to strength begins with something as simple as one careful movement in the morning.